Hi everybody, this video of mine is about rosacea, which is a common skin condition that causes redness and visible blood vessels in your face. It may also produce small, red, pus-filled bumps. These signs and symptoms may flare up for weeks to months and then go away for a while. Rosacea can be mistaken for acne, other skin problems, or natural ruddiness. Rosacea can affect anyone, but it's most common in middle-aged women who have light skin. There is no cure for rosacea, but treatment can control and reduce the signs and symptoms. Now let me tell you the symptoms. These signs and symptoms include facial redness. Rosacea usually causes a persistent redness in the central part of your face. Small blood vessels on your nose and cheeks often swell and become visible. And the second symptom is swollen red bumps. Many people with rosacea also develop pimples on their face that resemble acne. These bumps sometimes contain pus. Your skin may feel hot and tender. Eye problems. Many people with rosacea also experience dry, irritated, swollen eyes and red swollen eyelids. This is known as ocular rosacea. In some people, the eye symptoms precede the skin symptoms. Then another symptom is enlarged nose. Over time, rosacea can thicken the skin on the nose, causing the nose to appear bulbous, and this condition is known as rhinophyma. This occurs most often in men than in women. If you experience persistent redness of your face, see your doctor or a skin specialist for a diagnosis and proper treatment. If you go to your GP, he can treat you as well, or he can refer you to dermatologist. Now let me tell you the causes of rosacea. Some people call it as a rosacea, but usually it's better pronounced as rosacea. Okay. The cause of rosacea is unknown, but it could be due to a combination of hereditary and environmental factors. Rosacea is not caused by poor hygiene. You need to remember this. A number of factors can trigger flare-ups. Now I'll tell you the factors which are the triggering. These include hot drinks and spicy foods, red wine and other alcohol beverages, temperature extremes, sunlight or wind, emotions, exercise, drugs that dilate blood vessels, including some blood pressure medications, and some cosmetic products also can cause rosacea. Coming to the risk factors, anyone can develop rosacea, but you may be more likely to develop it if you are female or if you have light skin, particularly if it has been damaged by the sun, or if your age is above 30, if you smoke, or if you have a family history of rosacea. So these are the risk factors. Coming to the complications, over time the oil glands, which are known as sebaceous glands in your nose and sometimes your cheeks, become enlarged, resulting in a build-up of tissue on and around your nose. This is a condition known as rhinophyma, which I told you just now. This complication is much more common in men and develops slowly over a period of years. Now let me tell you the diagnosis and treatment of rosacea. First of all, diagnosis. No specific test is used to diagnose rosacea. Instead, your doctor relies on the history of your symptom and an examination of your skin. You may have tests to rule out other conditions such as psoriasis, eczema, or lupus. These conditions can sometimes cause signs and symptoms similar to that of rosacea. If your symptoms involve your eyes, your doctor may refer you to an eye specialist, ophthalmologist, for evaluation. Now coming to the treatment. Treatment of rosacea focuses on controlling signs and symptoms. Most often this requires a combination of good skincare and prescription drugs. The duration of your treatment depends on the type and severity of your signs and symptoms. Recurrence is common. And now coming to the medications. New rosacea medications have been developed in recent years. The type of medication your doctor prescribes depends upon which signs and symptoms you are experiencing. You may need to try different options or a combination of drugs to find a treatment that works for you. Now let me tell you some of the prescription drugs that include topical drugs that reduce redness. For mild to moderate rosacea, your doctor may prescribe a cream or gel that you apply to the affected skin. Brimonidine, which is coming in with the name of Mirvaso, and oxymetazoline, also coming in the name of with the name of Rofed. This reduces redness by constricting blood vessels. You may see results within 12 hours after use. The effect on the blood vessels is temporary, so the medication needs to be applied regularly to maintain improvements. Other topical products have less effect on the redness but help control the pimples of mild rosacea. These drugs include azelaic acid, which comes with the names of Azalix and Phenecia, and another drug that is metronidazole, which comes with the names of Metrogel. So this can be applied. And another drug which is ivermectin, also coming with the name of Sulentra. You need to remember that with azelaic acid and metronidazole gel, noticeable improvements generally do not appear for 2 to 6 weeks. Ivermectin, which comes with the name of Sulentra, may take even longer to improve skin, but it results in a longer remission than does metronidazole gel. Okay, now there are some oral antibiotics. Your doctor may prescribe an oral antibiotic such as doxycycline, which comes with the name of Rosacea, for moderate to severe rosacea with bumps and pimples. Then there is an oral acne drug. If you have severe rosacea that does not respond to other therapies, we may suggest isotretinoin, which comes with the name of Amnistim claravis. This is a powerful oral acne drug that also helps clear up acne-like lesions of rosacea. Do not use this drug during pregnancy as it can cause serious birth defects. Now there are some other therapies such as laser therapy and other light-based therapies may help reduce the redness of enlarged blood vessels. Repeat treatments may be needed periodically to maintain the improved appearance of your skin. Now let me tell you some of the lifestyle and home remedies. These self-care practices may help you control the signs and symptoms of rosacea and prevent flare-ups. First of all, you need to identify and avoid triggers. Pay attention to what tends to cause flare-ups for you and avoid those triggers. Secondly, you need to protect your face. Apply sunscreen daily. Use a broad-spectrum sunscreen which blocks both ultraviolet A and ultraviolet B rays with an SPF of 30 or higher. Apply sunscreen after you apply any topical medication you are using for your face and before applying any cosmetics. Take other steps to protect your skin, such as wearing a hat and avoiding midday sun. In cold, windy weather, wear a scarf or ski mask. You should treat your skin gently. Do not rub or touch your face too much. Use a non-soap cleanser and moisturize frequently. Avoid products that contain alcohol or other skin irritants. Also, you need to reduce visible redness with makeup. Some makeup products and techniques may help reduce the appearance of skin redness. You can try Power Cosmetics with a green tone and matte finish. Now there are some alternative medicine which I should tell you. Gentle daily facial massage may help reduce swelling and inflammation. Use a circular motion with your fingers starting on the central part of your face and work towards the ear. A recent study suggests that caffeine may reduce the risk of developing rosacea. Even so, hot beverages are a common trigger. Many other alternative therapies, including emo oil, laurel wood, and oregano oil, have been touted as possible ways to treat rosacea, but no conclusive evidence supports the idea that any of these substances are effective. You should talk with your doctor if you are considering dietary supplements or other alternative therapies to treat rosacea. He or she can help you weigh the pros and cons of specific alternative therapies. I hope you like this video of mine. If you have rosacea or if you are suffering from any other illness, please post your comments in the comment section of this video, and I'll try to reply you as soon as possible, or I'll try to make a video on your condition. If you have not subscribed my channel till now, please subscribe it and press the bell icon so that all upcoming videos are delivered to your inbox directly from YouTube notifications. And if you think that my videos provide little bit benefit to you, even if it is a 10% benefit, please like my videos and share my videos with your friends and families and over social media. Thank you very much for watching this video. See you in next video. Bye.